Good morning, church family. So sorry I couldn't be there today, but the pastor did ask me to talk a little bit about maternal health. This is very dear and near to my heart as I recently gave birth to Taysom about 3 months ago. So when I was pregnant with Taysom, we did find out pretty early that he had something going on with his heart. So we had different specialties. I did not only have my OB, but I had fetal maternal medicine and a surgeon that worked collaboratively together to help us navigate through that. So unfortunately, a lot of women do not get that experience, especially women of color. So I just kind of wanted to shed light onto some of the disparities in obstetrics. So let's go ahead and get started. So let's kind of define health disparities. So the Harvard Institute of Medicine defines disparities as racial or ethnic differences in the quality of healthcare that are not due to access-related factors or clinical need, preferences, and appropriateness of intervention. The World Health Organization defines it as the difference in health which are not only unnecessary and avoidable, but in addition are considered unfair and unjust. Disparity is just not a difference, but a difference that systemically negatively impacts less advantaged groups. Disparities are multifactorial. It includes social, economic factors, including poverty, education, and unfortunately racism and discrimination. When I was researching this topic, I came across a study that looked at Hispanic, Indigenous, and Black women. And they reported that they felt that they were mistreated by their providers. This included scolding, ignoring, and refusing to help them. Another study looked at Black adults, and that study showed them that Black adults felt that the providers flat out didn't listen to them or believe them, and felt that they were not telling them the truth and either refused to treat them or give them pain medicine. So this is definitely an issue and a big problem in the United States. So maternal mortality is defined as death during pregnancy or 42 days after. So I have some graphs that I kind of want to show you in regards to maternal mortality. So the first graph this is a graph of the wealthiest countries in the world. So unfortunately, United States is number one. As you can see, there are 23.8 deaths per 100,000 live births. And then it breaks it down between Hispanic, white, and Black women. And Black women by far exceeds all other race. There are 55.3 deaths per 100,000 live births. Next slide. This slide shows just in the United States. So I thought this was pretty good. It's a bit dated, but I thought, it was a good reference. So as you can see, the top is the mortality rate with all races, and then the bottom is mortality rate just for Black women. So in Indiana, the maternal mortality rate overall is 21.7, but for Black women, it's over 30 deaths. And then this slide shows the number and rate of mortality deaths by race and ethnicity in 2018 through 2021. So this is more of a projection. So as you can see, in the last few years, the number and rate of maternal death has increased, most likely from COVID-19, because, women were isolated. They were not able to get to those appointments and receive that prenatal care that they desperately needed. So why are women dying? What are the causes of maternal death? So Some causes of maternal death are severe bleeding, mostly bleeding after childbirth, infections, usually after childbirth, high blood pressure during pregnancy, complications from delivery, and unsafe abortions. Cardiovascular conditions such as blockage of your arteries and veins, stroke, cardiomyopathy, and heart disease. Problems with anesthesia, amniotic fluid embolisms, and non-cardiovascular conditions such as diabetes. This graph I thought was pretty good because it breaks down the leading causes of deaths based on if you're pregnant, days after delivery, postpartum. And as you can see, the number one across the board is cardiac conditions. So what is being done? What are we doing to help combat this? So the CDC has launched a campaign. It's called the Hear Her campaign. It's a campaign to help prevent pregnancy-related deaths by sharing potentially life-saving messages. Policies are underway for extending post-pregnancy Medicaid. Right now, it's only a couple months after delivery. They're looking to increase it to a year postpartum. And then also extending paid time off, and then advances in specialized care for high-risk pregnancies and deliveries. And then hospitals are implementing quality measures that are hopefully helping to reduce maternal mortality. So some things that we can do, and as a mother and as the family member, our friend of that mom. So of course, advocate for yourself. Speak up if anything doesn't feel right or is concerning. Let the doctor know. Do your research. Do your research on the facility. Do your research on your doctor. And then know the warning signs of the urgent maternal signs. This includes severe headache, extreme swelling of hands and face, trouble breathing, heavy vaginal bleeding or discharge, overwhelming tiredness, and more. Let your provider know if you have any of these. And then share your recent pregnancy history during each medical visit. When you or our loved one is going to your prenatal checkups, let the doctor know what's going on with you. Don't blow it off or think nothing's wrong. It may be nothing, but it could be something, and this could save your life. Connect with healthcare and social support systems before, during, and after pregnancy. So these are some things that we can do to help prevent maternal mortality. So I wasn't trying to be share this doom and gloom, but I do think it's very important that we know what's going on and be educated and know the warning signs. So, because this could help save a life. So thank you, and I hope you guys have a great rest of your day.